yourselves or know somebody who is uninsured? Out of those of you in the room who are fortunate enough to have health insurance, how many of you think you have a good coverage for a good price with your health insurance? It's pretty good, actually. How many of you who just raised your hand are government employees? How many of you in the room has ever had an insurance company deny treatment or payment of a medical claim in this room? And just one other quick check of how many of you either yourselves or know somebody who has a pre-existing condition that makes it either difficult or, if not impossible, to get coverage on health insurance. Okay, that's probably the strongest statement of why we're here. A little bit by background, those of you who are here are probably disproportionately more likely to have already been following the health care discussions and debate. But by way of background, let me add, and I'm sorry if that's reverberating, Colorado, as you know, has an approximate number of about 770,000 uninsured people in the state right now. Out of those, almost 180,000 of those are children who, given our labor laws, actually can't work to provide their own health insurance. For those who do have insurance, by a quick snapshot, premiums for individuals have risen 82% in Colorado from the years 2000 to 2004. That's an 82% increase over just a few years. And premiums for small business employers have increased by more than 140% from 2000 to 2005. This so far outpaces the general inflation indicators out there that if the rest of our economy inflated at the same rate of those health care premiums, our entire economy would virtually collapse in less than a year. With this, by way of background, for those who are fortunate enough to have health insurance, we are dealing, as you know, with very real issues about how we deal with interference by insurance companies with medical treatment, protecting the balance of privacy between patient and provider, and how much outside influence, if any, do we find acceptable for outside parties directing medical care outside the doctor-patient relationship. I don't have to tell you that in the world of those who do have insurance, we are here because the context of pretty much unchecked growth on the increase in the cost of copays that people are out of pocket, the increase in deductibles. We are facing trends of more and more exclusions from private insurance. The art and science of denial of care and delays or denial of payment when people are insured is pretty much down to a perfected art. So we're in the context of how can we keep losing coverage every year and spending so much more for it, and how long is that path really sustainable? At some point we're going to find ourselves all pretty virtually bankrupt and not having a whole lot of coverage to really show for it. So here's a fact, and then we're going to proceed through our initial part of our panel, by the way, just to give you some outlay, about 5 minutes each, and then the entire rest of the forum is going to be Q&A. So no one plans to get sick. No one plans to get injured or disabled or to acquire any kind of chronic disease, but obviously it happens nonetheless.